Like this boy, I was a grateful patient that wanted to thank an amazing nurse. So why did it take me 8 months to express my gratitude? I had to go to the hospital and find her in person. That seems silly. If we could make it easy for patients to thank caregivers, would more people express their gratitude? I pulled together a team and we built an MVP to make it easy for patients to thank caregivers from their phone, their computer, from anywhere. But as you might guess, healthcare, it has a lot of gatekeepers. We discovered 4 key gatekeepers who each had concerns that initially kept us from testing our MVP. The hospital COO, VP of HR, patient care manager, and philanthropy officer. So what did we do? We talked to hundreds of nurses, doctors, and administrators. We learned that nurses and other team members are doing more with less, feeling stressed, and as you can see, many are approaching burnout. Hospital leaders know this is a problem they need to fix. So how do we turn the gatekeepers into advocates of our particular solution? We needed to understand how the problem we were solving could either save money or make money for the hospital. Gratitude is great, but hospitals are a business. It was fascinating to me to find out that hospitals with higher patient satisfaction scores would get reimbursed at higher rates from insurance companies. Which hospitals get the billions of dollars in these incentives is currently determined by inherently flawed satisfaction surveys. We have the ability to help hospitals get reimbursed at the higher rates because our gratitude data can be used to augment old school paper surveys. We also save money for the hospitals by improving morale, which leads to improved retention. So why were our gatekeepers afraid to test our MVP? At first, all we kept hearing was HIPAA. Why is the word HIPAA on a hippo? I don't know. I also didn't know why HIPAA should be a barrier to patients thanking caregivers until we talked to the COO of Stanford Hospital. He was able to explain that patients can say anything, but caregivers cannot. HIPAA requires that caregivers respond without any specifics about patients to protect patient privacy. So what did we do? We iterated our product and we added a new feature to our MVP. Pretty simple, pre-written general responses like these. HIPAA concern, gone. So our next gatekeeper, the VP of HR, told us nurses would never put their photo on a website, and you get that, thank you. Nurses have never been listed online. It's just not something they've done. But we know the photo is a critical piece of our MVP because patients can't always remember a name. My hypothesis was that if you have a nice photo, you'd be much more likely to put it online. So we asked if we could run an experiment. We set up high-quality photo shoots in unused hospital rooms like this one. It turns out that over 90% of the staff put their photo on Doje once we took a good picture of them. So it's important to remember that gatekeepers can influence features, but they should not dictate them. Part of the art of turning gatekeepers into advocates is knowing when and how to push back. The patient care manager of this unit at UCSF was a very important gatekeeper to us. Her team of 140 people were going to be our pilot users, so when she asked if Doje could replace their paper card system for coworker gratitude, we decided to remove the real-time metrics that we thought would be critical to our MVP and replace it with the ability for coworkers to thank each other through Doje. And as you can see from the blue, that was a good decision because over half of the 645 total Doje notes were coworkers thanking their teammates. But beware of the unexpected gatekeeper. Before the UCSF pilot, we had gotten buy-in from the COO, VP of HR, and chief nurse at another major hospital. The deal screeched to a halt when we found out that the fundraising group was afraid that if patients could thank their caregivers directly through Doje, then less would donate through their Grateful Patient program. Crazy, I know, but it's human nature. So it's what they're measured on, right? So we added a feature to our product, which was a link to donate to the hospital after sending a thank you. Gatekeeper, now advocate. If you can turn your gatekeeper not just into an advocate, but into a hero, then these advocates will advocate for your product from inside the organization, and the best way to influence an organization is from within. So what should you remember? Successful entrepreneurs set the context to make choosing easy. What does that mean? That means if you really, really understand what's important to your gatekeepers, you can make some small feature changes that eliminate the gatekeeper concerns and still creates the best product for your end users. Where are we at today? After a successful pilot with UCSF, we're working with the leadership team on rollout plans for the rest of the hospital. We're also in talks with Stanford, Johns Hopkins, the Military Health System, and other major hospitals. Thank you.